Everyone, welcome and thank you for joining us today for this webinar on HIV and PrEP. My name is Sahar Sawyer and I'm pleased to be your host for this session. Whether you're a healthcare professional, an advocate, a student or someone personally affected by HIV, your presence here today reflects a shared commitment to knowledge, compassion and action. Today we'll be focusing on the transformative role of PrEP. We are especially privileged to have with us Dr. Anita Belgaonkar, a respectful general practitioner with extensive experience in sexual health and HIV prevention. Throughout the session, we encourage you to engage, ask questions, share your perspective, put your hand up and take full advantage of this opportunity to learn and connect. Over to you, Anita, Dr. Anita, and let's get started.
Thank you. So yeah, thanks so much for joining today. So we'll be talking a little bit about HIV and then also this medication that Sahar mentioned called PrEP or pre-exposure prophylaxis. So Sahar will kindly share my slides. Thank you.
I'm just doing this now. Bear with me while I just start. Apologies. Anita, when you're ready, can you let me know if it's sharing?
Yeah, sure. So let's see. So it's if you just go to the PowerPoint mode. The
where is it?
So you know the little button in the bottom right where it looks like a screen. Yeah. If you press that, then that will be in the presentation mode.
This one?
Yes. Perfect. Okay. So yes, I'm Anita and I'm also a GP at the Park Practice in Annerley, and I also work as a South East London HIV GP champion, where my role is to try and increase awareness in primary care, get GPs to do HIV tests, try and reduce stigma surrounding HIV, and overall, hopefully improving the well-being of people living with HIV as well. Thank you. Next slide, please, Sahar. So why are we talking about HIV? So, well, it's very relevant, particularly in South East London. South East London has the highest number of people living with HIV in the whole of the UK. We also need to break the stigma surrounding HIV. So people living with HIV still experience a lot of stigma and discrimination. And also that also puts people off testing because they think if I do a test, then it's going to have an adverse effect on my life if it's positive. And actually what we want to do is diagnose people early, and that's because these days the treatments for HIV are amazing. So although there's not a cure, there are really effective treatments, which mean that people living with HIV who are on effective treatment can live a long and healthy life. It's not like it was 20 years ago, where essentially having HIV was a death sentence. It is absolutely not like that anymore. Okay, next slide, please. So we're going to talk a little bit about what HIV is. So HIV stands for the human immunodeficiency virus. It's a virus that damages the cells in the immune system. Sorry, Sahar, you have to click through it. Yeah, thank you. It's found in the semen, vaginal fluids, anal fluids, blood, breast milk. But just to be clear, it's not found in saliva, sweat, or urine. So if you share a drink with someone living with HIV, you're not going to contract HIV. Or if you sit on a toilet seat that someone living with HIV has used, you're not going to contract HIV as well. So the way HIV is passed on is through either vaginal or anal intercourse without a condom. We know that condoms are a really effective way of preventing HIV transmission. If someone is sharing injecting equipment, blood transfusions, although in the UK that would be unheard of these days, this is more kind of blood transfusions maybe in countries abroad where sterile medical procedures may not always be observed. If someone has a needle stick injury, so these would be maybe healthcare professionals, but again, this is extremely rare. And again, another extremely rare cause in the UK would be transmission from mother to baby. And if anybody here has had a baby, you would know that when you are first pregnant and you have a whole set of blood tests, all pregnant women are screened for HIV as well as hepatitis. And if someone is found to have HIV, then there are really effective treatments when someone is pregnant that would prevent HIV being transmitted to a baby as well. So the mother to baby transmission is extremely, extremely rare in the UK. So when we do tests for HIV, the amount of virus in the blood is called the viral load. Okay, Next click, thank you. And we know that HIV damages our immune system. So the amount of damage caused to the immune system is measured by checking the number of immune cells. And these are called CD4 cells. They're a type of red blood cells, white blood cells. And the higher the number, the better. So above 500 CD4 count is considered to be normal. So AIDS, I mean, we don't really use that term anymore. It's quite a scary, outdated term. I think these days we would refer to AIDS more as advanced HIV, but it's a name used to describe potentially life-threatening infections that can happen when the immune system has been severely damaged by the HIV virus and the CD4 count has become very low. But again, because of effective treatment, we really don't see, very many cases of advanced HIV, and we definitely shouldn't in this day and age because the treatments are so good. So when someone contracts HIV, sometimes they may have no symptoms at all. Sometimes they may experience a short flu-like illness in the first 2 to 6 weeks after exposure. It could be like having a bit of a sore throat, just feeling a bit fluey, sometimes glands popping up in the neck, sometimes a rash. So these symptoms can be quite non-specific. This is called seroconversion. But after these symptoms disappear, most people will have no symptoms, and sometimes they can have no symptoms for a number of years. So sometimes people could maybe not be diagnosed with HIV until about 5 to 10 years after the initial infection, which is why it's really important that we do tests, even if people have no symptoms. Okay. So the only way to check if you acquired HIV is with a blood test. And there's obviously some really good news in the sense that the medications used for HIV, we call those antiretroviral medications, lower the virus in the blood, allowing the immune system to repair itself. And once the virus can no longer be measured in the blood, then it's called undetectable. So someone who's undetectable, that means they have an undetectable viral load. And if somebody living with HIV has an undetectable viral load, then that means that they cannot pass HIV on to their partner. So their HIV is untransmissible. Okay. Sorry, next click. Thank you. So there is a really game-changing concept for people living with HIV, and that is U equals U. So if the virus is undetectable in the blood, then it is untransmissible and cannot be passed on to anybody else. And this is why it's really important to diagnose someone early in their journey with HIV, start them on treatment, because we know that this breaks the chain and it means that the HIV won't be passed on. So this is moving on to this is called the Do It London campaign, and you may see posters up in your GP surgery or other settings. And there are 4 proven ways to prevent HIV. So firstly, testing, so doing lots of tests. So if someone believes they could be at risk, or even just opportunistically, so you may be offered an HIV test in your GP surgery. For example, in the surgery I work in, the Park practice, we routinely offer HIV tests whenever we're requesting bloods, because we know that sometimes people have no symptoms and we want to pick up anyone living with HIV so we can start them on treatment. So first thing is testing. Second thing, condoms. They still remain a really effective way to prevent HIV and a range of other STIs. And of course, they can prevent against any unwanted pregnancies as well. And also PrEP, which we'll come on to in a second, which is pre-exposure prophylaxis. And then finally, that concept of U equals U. Which, as we said, is a game-changing concept. So just to reiterate again, if someone living with HIV is on treatment and if they have an undetectable viral load, that means that they will not be able to pass HIV on to somebody else. And that is also game-changing for anyone who has a partner living with HIV. It means that they don't have to worry about contracting the virus as well. So we'll move on now to talk a little bit more about PrEP. So PrEP stands for pre-exposure prophylaxis, and it's a way that we can take control of our health. It's not just a medication, it's a movement, and anyone can be part of it. The UK is aiming to, well, the world actually, is aiming to end new HIV transmissions by 2030, and PrEP is a key part of this goal. Next slide, thank you. So PrEP reduces the risk of getting HIV. So just to reiterate, it cannot be given to someone who already has HIV. It is to reduce the risk of someone acquiring it. It stops HIV from getting into the body and making copies of itself. So HIV, as we said, is a virus. The way it damages our immune system is it replicates. And so PrEP stops the virus from doing that. And protection from HIV infection occurs if there are high enough levels of PrEP in someone's body. So if someone is prescribed PrEP, it's really important that they take it correctly. So what is it? It's a tablet taken before sex, so it's called pre-exposure, and prophylaxis means to prevent infection. So other examples of prophylaxis are if you went abroad and you went to a country with malaria, you would take a tablet to prevent against that. So that is also a prophylaxis as well, so malaria prophylaxis. So PrEP in the UK is usually a drug called Truvada, which contains 2 different ingredients, but sometimes it can be another type of medication, and it's over 99% effective when taken correctly. So, I mean, it is quite an incredible kind of medication. Again, another game changer in HIV prevention. And also it's free through the NHS. At the moment, it can only be prescribed by sexual health clinics. So obviously our local sexual health clinic would be Beacon and Beacon, and you can walk in, have a consultation and be prescribed it. At some point, it might be that GPs prescribe it, and I feel like we should as GPs. At the moment, we're not allowed to, but we prescribe all sorts of other drug regimes. We prescribe contraception. You know, wouldn't it be amazing if you could go and visit your GP and have all of your sexual health needs and contraceptive needs met? So watch this space. One day it might be that GPs prescribe PrEP too. So who should take PrEP? Well, basically anybody can take PrEP. Anyone who is having sex could take PrEP, but these are maybe the sort of higher risk groups. So if you're HIV negative and at high risk of HIV, and for example, if you may not always use condoms, then yes, you could be eligible. If you've had multiple partners, not just a regular partner. If you've had a recent STI, so sexually transmitted infection. If you've had a recent need for PEP. So PEP is something slightly different. That's post-exposure prophylaxis. We're not going to really cover that today. If you or your partner inject recreational drugs, if you use drugs that may be used for chemsex, if your partner is living with HIV and isn't taking their HIV medications regularly, then yes, you could be eligible for PrEP. But remember what we said, if you've got a partner living with HIV and they're on medication and their viral load is undetectable, then actually there is zero risk of you contracting HIV, so you may not need PrEP in that case. And also if you live in or come from areas where HIV is more common. So talk to your GP, practice nurse, sexual health clinician about how these risks affect you, and you can decide. If you also go to the Sexual Health London website, you can also run through a whole series of steps as well to decide if you would be eligible for PrEP. So as we said, how well does it work? So it's 99% effective in preventing HIV from sex when it's taken correctly, and thousands of people take PrEP in the UK. So it is a very safe and effective drug. So PrEP and side effects. So most people taking PrEP don't get side effects. However, like all other medications, you may get some mild side effects like nausea, diarrhea, bloating, things like that. But usually, as with a lot of medications, after taking them for a while, often these stop. Occasionally, PrEP can cause more serious side effects. For example, reduction in kidney function or bone health if you're using it for a long time. But this is why when you first go on it and during the course of treatment, your kidney function is monitored. And yes, most people will not have any problems at all when they take their PrEP. So does it interact with other medication? It doesn't interact with most medicines, but if you routinely take other prescribed medications, then always tell your doctor, including your GP, that you're taking PrEP, because your GP may not be aware, because you may have been started it in the sexual health clinic. And of course, sexual health clinics won't always communicate with your GP surgery because it's quite a confidential service. So always mention to your GP if you're taking PrEP. And you can also speak to a pharmacist as well if you ever wanted to check for any drug interactions, including with over-the-counter medications. So the group that we particularly want to promote PrEP in is women. So we know that men who have sex with men often know about PrEP, and they are the largest users of PrEP in the UK, but it's women that don't really know very much about PrEP. So we want to particularly increase the awareness about PrEP in women. And this is also because there are rising rates of HIV amongst women, particularly women of Black African origin. It means that as women, if we have PrEP, we are taking control of our sexual health. Unlike condoms, which require partner cooperation, PrEP is a self-controlled method of HIV prevention, and it provides protection in different situations. So like we said before, having a partner with HIV who may not be taking their medication, having multiple sexual partners, especially if condom use is, inconsistent, being in a relationship where you don't know your partner's HIV status, and also, in the unfortunate situation if someone is experiencing any sexual violence or coercion, then PrEP is something that someone can use to kind of take control of their health. So how do we start PrEP? So firstly, you need to go and visit a sexual health clinic, because as I said, GP surgeries can't prescribe it. Neither can kind of pharmacists, but this may all change because there is actually a pilot practice in Lewisham that is starting PrEP, which is really exciting because it means that if it works, it might be something that, if it works well as a process, it might be something that other GP surgeries around London can adopt as well. So the first thing to do if you're interested in PrEP is go to sexual health clinic, and so our local one would be Beckenham Beacon. Sorry, someone has their audio on. Would you mind switching off audio? Okay, so that's fine. Okay, so sorry, could we go back?
Yeah.
Sorry. I think we might have gone forward a bit. Go back again, sorry. There we go. Fine.
Oh, okay, there is.
Oh, yeah. There we go. Yeah. So firstly, visit Central Health Clinic. And before you start PrEP, you would have a blood test for HIV, kidney function, and other, you'd have an STI screen, so checking for chlamydia, gonorrhea, and other blood tests to check for things like Hep B and Hep C as well. And if that's all fine, then you can start PrEP immediately. And for a lot of people, it might be a daily pill. There are some regimes where it might be more event-based, but usually for women in particular, it would probably be a daily pill. Okay. And while you're on PrEP, you would have regular reviews every 3 months with the sexual health clinic. So an HIV test. Now, I think often they'll give you a code to scan where you can just order the kit online, and an STI screening if needed. But every 6 months, I think for the first year, you would have a kidney function test. And then if everything is fine, sometimes you may not need one for another year after that. And all of these things help ensure that PrEP is working safely and effectively. Okay, so the benefits of PrEP, like we said, it protects your health, your future, gives you control over HIV prevention. It can also be used with other prevention methods. So, of course, condoms, because condoms will also protect against, other STIs and also pregnancy as well. It is safe for most women, including during pregnancy and breastfeeding. It does not affect fertility, and it can be used alongside contraception, the pill, that sort of thing as well. So common concerns and myths. So PrEP is only for men who have having sex with men. So that's completely false. It's for anyone that could be at risk of acquiring HIV. And as we said, we particularly want to promote it amongst women. Number 2, PrEP is unsafe. Again, it's false. If it's really well researched and it's based on thousands of kind of people being enrolled in trials. It's very well researched and safe. And number 3, I don't need PrEP if I trust my partner. Of course, that is a personal decision, but if you feel that they could be at risk, or there will be any other situations that make you feel that you could be at risk, then of course, think about PrEP, because it's all about protecting your health. Okay, so again, how do I get PrEP? So you can visit any sexual health clinic, but particularly if you live in Bromley, then yes, our local sexual health clinic is at Beckenham Beacon, and they are lovely there. And I also work quite closely with them as well. They're very approachable. Okay. So yes, so just the final messages. So PrEP is a powerful tool for everyone. It's about knowing our options, protecting our future, and of course you can talk to a healthcare professional today about, maybe not right now because it's evening, but maybe tomorrow or the rest of the days, talk to them, about starting PrEP, or if you're thinking about it and you're not sure, speak to someone about it. And then these are just some little leaflets that you can order from various websites. So there is iBase, I Want PrEP Now, Prepster. There's the Sophia Forum, which is particularly for women as well. And there's some really informative leaflets. So we have some of these in our GP surgery, and sometimes our practice nurses will also give them out. For example, they see a lot of women for their cervical smears or pill checks. So essentially, we want to spread the word about PrEP. So you can always talk about PrEP with anyone else as well. So yeah, spread the word, talk about PrEP, and if anyone has any questions, actually I've got a few more slides very quickly. So we also obviously can't underestimate the importance of condoms as well. So there are some free condom schemes that I just wanted to highlight. So for young people between the ages of 13 to 24, you can order free condoms through something called the C Card scheme. Okay, and it's also, that's the website linked there as well, and this gives you access to free condoms at a wide range of outlets in the borough of Bromley, and also within London as well. Okay, and if you are a man who has sex with men, then there is another organisation called Man to Man that also provides free condoms as well, and you can access that through the Sexual Health Bromley website as well. And then finally, there's another scheme. It's the Wisdom Scheme. It provides free condoms, also other kind of confidential HIV and STI prevention advice to anyone of African and Afro-Caribbean community origin who lives in Bromley as well. If you live here or work here or study in the borough, then you can get free condoms if you're of those ethnicities by post or at participating outlets as well. So another way to protect ourselves is also condoms as well. Okay, so thank you for attending today, and has anybody got any questions, or if you feel like you can also post it in the chat, there's a Q&A bar I think as well. Anyone have any questions?
Okay.
No? Okay.
No questions.
Sorry.
Thank you, Dr. Belgamkar. That was a very informative presentation. Thank you. Oh,
do you have a question?
Yeah, I was going
brilliant.
to ask, thank you for the training. Is it possible for us to have the recorded version of this, please? I can share with some of my colleagues who had left because of the timing. The office had already closed, but because I wanted to listen to it, that's why I stayed to listen to it.
Thank you. We have actually recorded this session. So what I shall do is we will post it on our Penge PCN website.
Okay.
And it will be on there. It will also be on our Facebook and on our Instagram. I could possibly send it to you as well, but if you go on our Penge PCN website, on the link there, it will have it on there from tomorrow after midday, if that's okay with you.
Yeah, I registered my email is information@directhealthcare. Is it possible for you to please
Yep, if you
post
can
the slides.
actually, it'd be great if you could just send me in the chat your email. That'd be great.
Oh, okay.
And can you see it in the chat? If you just write your email on there for me, I can send the
Let me
record.
quickly do that.
Thank you.
Thank you.
Oh,
Thank you
for
very much.
joining.
Thank you. Thank you so much for that presentation. And it will, as I said, it will be on our website to rewatch it. Thank you, Doctor.
Oh no, thanks,
And,
Sahar. Thanks for sorting
thank
my
you so
slides out.
much.
Take care. Bye-bye.
Thank you. Bye.
Bye, everyone.
Bye. Thank you, everyone.